I think it's time to get started. Hi, everybody. My name is Stephanie Nadi Olson. I am a Palestinian American, and I am here today as I've heard from countless people that they want to help Gaza, but aren't sure what to do or where to donate. Our goal today is to help make those decisions easier for each of you by highlighting 3 incredible organizations serving the orphans of Gaza. I want to thank each of you for being here today. Each of you has decided that instead of throwing your hands up in despair at the orphan crisis in Gaza, you're going to learn more, understand better, and discover what actions you can take to make a difference. I want to thank our panelists, Gaza Health Initiative and Atlanta Multifaith Coalition for Palestine, and the many people who pulled this event together, all of them with very full plates, and many of them literally saving lives each day. We are here out of a desire to bring light to an otherwise very dark time for millions of Palestinians in Palestine and abroad. We're here to remind one another of our shared humanity, and that at a time where it seems the world cannot even agree on what color the sky is, we can all agree that the children of Gaza, close to 20,000 of them, new orphans in the past 8 months, deserve to live, deserve health care, and deserve the dignity of a life that is honored and meaningful to others. Before we dive in, please note that you can drop any questions that come up along the way in the chat. We will not have a live Q&A today, but we'll be tracking all questions and will address as many as we can in a follow-up email to this audience after the meeting. Our first speaker is Dr. Fawzi Al Hammouri, a globally esteemed pediatric endocrinologist, chairman of Specialty Hospital in Amman, co-chair of the Gaza Health Initiative. Dr. Al Hammouri will review the current state of the orphan catastrophe in Gaza. Over to you, Doctor.
Thank you, Stephanie. I would like first to thank my dear colleague, Dr. Omar Lattouf, for arranging this important roundtable. I also would like to thank Atlanta Multifaith Coalition for Palestine. And here today, we are to speak for those who cannot speak for themselves, to shed light on the crisis of orphans in Gaza. These orphans, these children in Gaza, they deserve our attention. They deserve that we all try to support them. But before going that, I have to introduce Gaza Health Initiative, which was started in November last year between Omar and myself on how to rebuild the health sector in Gaza. Now this initiative expanded. Now we have more than 50 organizations from all over the world. The Gaza Health Initiative was launched in Amman, Jordan in February 2024 at the first international conference to rebuild health sector in Gaza. And we were amazed with the number of attendees and the global presence of more than 700 participants. Out of that conference, we announced Amman Declaration, and also we issued a Future of Gaza Health Needs Assessment Report. GHI became the link and catalyzer for partner organization, and a lot of programs has emerged out of that. Some of the activities that we have been working on over the last few months, we started basically on the urgent needs. First of all was sending medical missions. We already sent more than 20 medical missions, which include more than 250 doctors and nurses to Gaza hospitals, because we know that the healthcare workers in Gaza has been overwhelmed with the huge number of patients and injuries. But before we send these medical missions, with our collaborators and our partners in the Mental Health Committee, we do for them pre-deployment mental health sessions. So we try to help the doctors and nurses before they go to Gaza, because they will see things that they have never seen before. With these doctors, we tend to send a lot of medical supplies and medical equipment that they will need during their work. But unfortunately, since May 7th, when the Rafah crossing has been closed, we were no more able to send with the doctors any medical aid. So we had to send it through other channels, but it is more difficult. Also, we have been working on medical evacuation because the WHO estimated that 9,000 severely injured patients need to be evacuated. Our partners like PCRF, Children Not Numbers, and KHCC already has evacuated a few of those. Also, we received a plea for premature baby formula because actually, although the mothers in Gaza usually breastfeed, but during the last few months, they were unable to breastfeed, either because they are malnourished themselves or because they are dead. So we had to send a lot of baby formula, especially special formulas. Today, after 253 days of war in Gaza, more than 37,000 Palestinians has been killed. More than 85,000 has been injured, 1.7 million displaced. 80% of the hospitals are out of service. 400 healthcare workers has been killed, and more than 300 has been imprisoned. But as we are gathering today to talk about children, I will share with you some of the heartbreaking figures. 15,700 children has been killed in the last 8 months. Believe it or not, this figure exceeds the children killed over the last 4 years in all the conflicts in the whole world. So in 8 months, Gaza lost children more than the whole world in all conflicts. 3,600 children are missing, most probably under rebels. So we can add this figure to the 15,700. 34,000 children has been injured. 1,500 children has lost limb or suffer from permanent disability. Almost all children has been displaced. Most of the children, if not all, has lost their schools. They have no clean water. There is no food, no vaccination, and no medical treatment. Actually, there are about 3,500 children are at risk of starving to death. There are 33 documented children has died because of malnutrition. You may have seen the new photos in the news, the photos of Yazan Kafarne. He has been all over the news. Actually, he died at 9 years of age due to severe starvation. This famine is man-made. It is not due to natural disaster. Gaza is under siege. You can see these thousands of trucks carrying humanitarian aid, waiting for months at the Egyptian side of Rafah crossing. Now, I want to ask you a question. Did you ever hear about this term, WCNSF? Actually, I myself didn't hear about it until it was invented by doctors in Gaza. It means wounded child with no surviving family. And this term has been given for an 11-year-old girl named Dareen. Dareen, she was rushed to the hospital alone after an airstrike hit her home, in which all family members were living in that home. 50 of them has been killed. So Dareen has been left alone, and this is why she was labeled WCNSF. Another victim named in this term, Ahmad Shabat. As you see, he is 3-year-old. He lost 2 limbs, and all his family has been lost except his younger brother, who is 2 years old. Can you imagine what this child is expecting in the future? This war has resulted in more than 17,000 new orphans in Gaza. The international community must act swiftly and decisively, because every day that passes without ceasefire, more children will be left without the support and the care of their parents. Your empathy, your voice, and your support can bring light to the darkest corners of Gaza. Let us remember that the orphans and children of Gaza are not mere statistics. They are children with dreams. They are human beings as much as we are. Together, we can help rebuild their lives and restore some of their hopes. Finally, we have to stand in solidarity, compassion, and strive for a world where no child is left to suffer in silence. Thank you.
Thank you, Dr. Al Hammouri, for grounding us in the heartbreaking state of the orphan crisis in Gaza. Our next speaker is Vivian Khalaf, the chair of the board of Palestine Children's Relief Fund, also known as PCRF. PCRF has U.S. headquarters in Los Angeles and has been on the ground in Palestine for more than 30 years. They are the primary humanitarian organization in Palestine, delivering crucial and life-saving medical relief and humanitarian aid, like food and water, where it is needed most. Over the years, they've sent more than 2,000 children abroad for free medical care and sent thousands of international nurses and doctors to provide free medical care to local populations in Palestine. Vivian is also an attorney and a partner at a prestigious law firm in Chicago. Vivian, please speak more about the critical work PCRF is doing for Gaza.
Thank you. Thank you, Stephanie, and thank you to all of the organizers who put this together. I know each one of us has their plates full and everyone is doing what they can, where they can, and there's still so much more that needs to be done. We're just all a drop in the bucket, and I say that time and time again so that people can understand the scope of the tragedy. But thank you, and PCRF is privileged to be amongst you. PCRF has been around for over 30 years now. We operate in 5 different countries, which is the United States, Italy, Jordan, Lebanon, and of course, Palestine, both in the West Bank and in Gaza. Currently, we have about 105 employees, 51 of them which were in Gaza previously. I'm sad to tell you and to repeat this time and time again that over 2/3 of our employees in Gaza have yet to be heard from. We lost 2, sadly, one of whom was a previous patient, an amputee who came to the United States, was installed with a prosthetic leg, went back to Gaza, became a field worker for PCRF, only to then lose his life. And another field worker also lost his life during these last several months. So it's sad, yet our people are the strength and the vitality, that we see when we do see them time and time again is just extraordinary. All of the work that PCRF has been doing since October 10th, and I say 10th because it took us a couple of days to realize what was happening, is on the shoulders of no more than 5 to 6 employees. And if it wasn't for the camaraderie and collaboration amongst other NGOs and PCRF on the ground, we would not have been able to do what we've been able to do. The Palestine Red Crescent, UNRWA, and many, many other private charities and NGOs that are on the ground have really added to our ability to make things happen. Now we have several, aspects to what we do. All over the world in these countries. We have a humanitarian project department that addresses the humanitarian needs in both the West Bank and Gaza, as well as Lebanon and Jordan. And we should not forget the trickle-down effect that this catastrophe has had on South Lebanon, on our refugee camps in northern Palestine. They are all suffering, even though the bulk of the suffering, of course, is in Gaza. But our work has been ongoing throughout the region. We support the vulnerable populations there with essential medical care and emergency relief because that's what PCRF does. We focus on healthcare and surgical care for vulnerable populations, for children who are unable to access quality healthcare and are in need of surgical care that is specialized and not available in their home countries. Our institutional strength and capacity development department, enhancing public healthcare sector quality and accessibility through strategic programs. We have a very vibrant treatment abroad program. That's where we take children who are unable to treat in their home countries abroad for specialized medical care and surgical care. And of course, this has been disrupted since October 7th, but we've since in the last months been able to take children out of Gaza into Rafah, then Egypt, and then to their final destinations if treatment is unavailable in Egypt. We have 75 children now that have been evacuated and are now in countries like Qatar. Doha has been very, very helpful in treating these children. The UAE, some are in Egypt. We just sent a child, our first patient, to Lebanon in partnership with the Ghassan Abu Sitta Children's Fund. And we have 7 currently in the United States. Over the last 30 years, we've been able to bring over 2,000 children abroad for medical treatment. Our medical missions program, also over the last 30 years, we've been able to service in excess of 60,000 patients on the ground in Gaza, in Lebanon, in Jordan, and in the West Bank. Teams of foreign doctors come into these countries, perform their surgeries, train to the best of their ability, and within the time constraints, local physicians, strengthen capacity, et cetera. Prior to October, we were at the rate of about a mission a month. And this has been consistent over the last 30 years. We currently have a mission in Gaza now. They've been there for the last 10 days. Hopefully they will continue to be safe and able to do the work that needs to be done. And our missions in Lebanon, Jordan, and the West Bank have been continuous and uninterrupted throughout the entire period since October. Our humanitarian programs department has supported 2 types of groups: monthly sponsorships for children who have chronic illnesses and are in need of medications on a monthly basis, as well as one-time sponsorships, one-time surgeries for children who are in need of one-time surgery. Again, we take them to Jordan, we take them wherever the treatment is available, perform those surgeries, and then send them back to Gaza or the West Bank, or the surgery is performed in their home countries. We're also proud of our 2 cancer departments. The first was in Rantisi Hospital. That was, of course, bombed to smithereens back in November. No longer is there. I look forward to the day where we can rebuild that, as well as the cancer department in Beit Jala in the West Bank. That is currently, up and running and very, very busy, sadly to say. So those cancer departments are something we were extremely and are extremely proud of and need to rebuild. In terms of our interventions since October 10th and since the war began in Gaza, PCRF has mobilized extensive resources to address the urgent needs of the Strip's vulnerable population, focusing on critical aid and urgent aid. Now, nutritional intervention and food and disaster relief is not something PCRF has historically done. But we were able to pivot, we were able to address the urgent needs because frankly, that's all we were able to do. We were in no position to send in doctors or to treat patients or to do any of our core work during this time. The need was for a starving population, a population that was on the verge of famine, critical care, urgent care, and that's what we were able to do. We addressed needs in the area of hygiene, to the tune of $1.3 million in hygiene interventions. That, of course, included kits that included things like toothpaste, soap, shampoo to displaced populations in southern and central Gaza. In North Gaza, where access to humanitarian aid is severely restricted, we've also been able to provide thousands of sanitary pads and comprehensive dignity packages for women and young girls, all sorts of hygiene products. Medical care also during this time, very strained, and Dr. Fawzi discussed it, and I'm sure my colleagues on the panel will also touch on this, the severely strained healthcare in Gaza in terms of medical facilities and resources that were either destroyed or stretched to their limits. In response, PCRF has provided substantial medical report to the tune of $5.3 million, nutritional interventions, addressing food insecurity due to the ongoing conflict. We've been able to spend over $18 million of generous donor funds. And of course, this could never be possible without our generous donors who continuously give every day, whatever they can. No amount is too small or too large. But without the private donations that PCRF has been able to maintain in terms of coming in, we would never, ever have been able to do this. So nutrition was in the area of almost $19 million. $2 million in relief supplies, which included pillows and blankets, winter clothing during the winter month, and other essential items. In terms of infrastructure development, I don't need to tell you that that's been nearly impossible to do. When you build, it's destroyed. You rebuild, it's yet destroyed again. All we can hope to accomplish is a field hospital here or there. We've invested funds as of February, $480,000 in the area of field hospitals in Rafah and Masawi Zuwaida in southern Gaza. Simultaneously, there's a field hospital project in Mawasi Zuwaida that started in May of this year with a budget of about $389,000. That's expected to be completed in September of this year. And all of this you'll be able to find on our website, on our Instagram pages for those of you that are listening and participating at www.pcrf.net. So, I mean, we can spend, and I can talk to you about the millions of dollars. We're almost at $30 million now in PCRF in terms of many types of interventions in Gaza, but that is absolutely nothing. That is a drop in an ocean, and we don't know when this is going to end. If I can tell you anything, and it's not anything that nobody doesn't know, is that help needs to have political will. And without political will and decisive action by nations in bringing a ceasefire together, number one, and ending the occupation of our people, you're never going to have a solution that is sustainable and long lasting for the Palestinian people in Gaza or in any of the camps that surround Gaza and Palestine. Northern Gaza is being starved once again. Food and water are wanting. Even though there's food waiting to come in, access is nearly impossible. And the specter of famine is again looming. I just came from Egypt yesterday, where I went to visit a couple of our patients that are currently in Cairo, awaiting to be transported to the United States for specialized surgical care. And I had the opportunity to meet with some non-governmental organizations that are operating in Egypt. And the stories I heard and the people I met there is just simply, heartbreaking. PCRF was there to distribute toys to the children from Gaza who were there for Eid. This was the first time they actually left their apartments in weeks. They have no place to go to smell fresh air. They have no entertainment outlets. They don't know anybody here. And it's a royal mess. I can't even describe the pain I saw in these people's faces. These are people that sold everything they had to be able to pay the fee that was required to exit Gaza and come into Egypt. There's no centralized system here, not here, I'm thinking I'm still in Egypt, but no centralized system in Egypt to take care of these families that left Gaza. Nothing. They had a permit for 40 days. They don't have telephones. They can't, for whatever reason, obtain a telephone line. They ran out of money to pay their rent. A woman told me she sold everything to be able to come, had one piece of jewelry left, which she sold to be able to make the rent, and now has nothing. This is the condition of these children and these families that have left Gaza. So we can't forget about them either. And a good portion of these children that are in Egypt are orphans as well. So we're not just talking about the 20 or 17,000 and still counting. The numbers are all over the place inside Gaza. But there's also orphans that have left Gaza for whatever reason, and we can't forget about those. PCRF is uniquely situated in that we've been there in Gaza for 30 years. We've become a part of the fabric of the community. Our employees are from there. We've been working every day. We haven't stopped. We are able, through our connections and through the vendors we know, have been able to source things through them locally. And we are able to continue to be agile and able to change at a moment's notice in order to get things done. And we haven't stopped. The two children I'll end with to tell you about that we've been able to bring to the United States, and hopefully that'll bring a smile to your face and joy in your heart, is Fadi Zant, who was dying of malnutrition. If you saw the blonde-haired child's video that went viral and you could see his bones peeking out from his back, had an underlying condition of cystic fibrosis. That was exacerbated by the fact that there was nothing to eat for this child. We were able to get him out of Gaza, of course, with our partners into the United States. He's vibrant, he's walking, he's got cheekbones. I visited with him in New York City a few days ago before coming to the Middle East, and he is just a vibrant young boy that is going to continue treatment in New York. I had abscesso, her leg was amputated on the kitchen table by her father. That video also went viral without any anesthesia. Cut her leg off. She lived to tell her story to the American people. She was getting treated in the United States, which is very ironic. And she mentioned that time and time again when she was interviewed by the press. She was able to get a prosthetic leg. She was thrilled that it wasn't plastic, that it felt like real skin. She's walking again. And she left about 3 or 4 days ago back home to be reunited with her father in Belgium. So those are the good stories. And there's thousands of others that we haven't been able to help yet. Let's not forget about them. They continue to need everybody's help. A lot of good organizations out there. We need to work together. We need to make this happen. There's a lot of work ahead of us. Orphans are a big piece, and we're here to do it. Thank you.
Thank you so much, Vivian. Thank you for providing all the context on the humanitarian disaster and the ways in which PCRF is helping. Next, we'll hear from Hanan Ashegh, founder and executive director of Goodwill Caravan. Hanan is based in the UK. She's a mental health practitioner and award-winning humanitarian. She founded Goodwill Caravan in 2015. They operate in England, Wales, and Greece, providing emergency aid to refugees by helping vulnerable refugee families, including Gazans, orphans, and detained and unaccompanied children who are at risk of human trafficking if left in detention centers, prisons, or are homeless when they arrive in the Greek islands. Hanan, thank you for being here. Please share more about Goodwill Caravan with our audience.
Thank you, Stephanie, and it's wonderful to be here. Thank you for having me. It's a real honor to be part of this panel with Gaza Health Initiative and with all of you here. Thank you for the introduction. I am a mental health practitioner. I was in research simulating mouse models of motor neuron disease when I met the first 2 children in the Calais jungle in France. I had gone to volunteer, and I was a volunteer for 2 years after that. Soon after, it was just an endless number of unaccompanied children that had lost their parents on the refugee trail that really inspired me to leave the NHS and found Goodwill Caravan. The initial work that we did was in France, reunifying unaccompanied children with their surviving family members in the UK, but then soon after, we moved to Greece, which is known as one of the biggest transit centers areas for refugees who would settle there if they found the support and the guidance that they needed. One of the main things that Goodwill Caravan does, if I were to summarize it in a sentence, is provide the support and the services that forcibly displaced populations need to reduce the likelihood of them being exploited. Refugees continue to move on and on. You see all those articles on the news of refugees crossing the Channel to the UK, going to Australia, to America, and people often wonder why. Why are they coming? Why don't they just stay put? Or why don't they stay in the first safe country? The reality is that most refugees and forcibly displaced people only have the smuggler on one side of with their phone, the contacts list. There's the smuggler and there's their family, and then all the people that traveled before them, possibly telling them how wonderful it is in England or in America or wherever they're going. But the reality is that over 30,000 unaccompanied children have gone missing after their arrival to the borders of Europe. And that number is the number that pushes us forward as Goodwill Caravan and sister organizations, some of which are on here, amazing organizations that are working to help the most helpless people. I believe it was Egil Jeb from Save the Children that said every war is a war against children, and that's so true. When it comes to places like Palestine, where the war has gone on for decades on end. The war didn't start on the 7th of October, even though that's when it made the news. And the sad thing is that people might not think, I think it was Vivian was talking about all these children and families in Egypt that have arrived. And you said that there was no centralized system. There is no centralized system. In Egypt, it's a big fat mess. There are over, I was reading this morning, over 100,000 Palestinians from Gaza that have crossed into Egypt, and there is no system for security. Goodwill Caravan work in Greece, in the UK, in Libya, and Pakistan. But more recently, we started our projects in Egypt in May, helping with the Sudan crisis initially with legal medical shelter. But now we're focused on people from Palestine that are crossing over. We've interviewed hundreds of families from Gaza, and the main thing that they asked for, we thought they'd ask for food bags and asked for shelter, and they did. But one of the main things that they asked for, surprisingly, and this was the first time in my experience in the 9 years I've been doing this, is psychosocial support. There are so many children that have, it's like selective mutism. They can't speak from what they've seen, and many of them can't see. And so I've been asked to share a couple of stories. One of the children who had lost a few of her siblings in Gaza made it to Egypt with her parents. She was one of the few that was lucky enough to make it with her parents, and she couldn't see. And that was because of the toxic gas. I'm sure some of my colleagues will talk more about that. And we were able to support with a medical procedure that helped her improve her eyesight even slightly. And that was such a huge deal, and her family were so grateful. My children, I have 3, ask for tablets and are annoyed if they can't have the social media for more than 2-3 hours a day. These children are asking for the ability to see. They're asking to go back home. They're asking to see their nana or their giddu, their grandparents who have passed in most cases. And the reality is that if you think about war and if you think about refugees, many people think, you know, they come to our country, they might take our jobs. And you've got a lot of right-wing groups in Greece, for example, that have set with one lighter a whole camp on fire because the tents are flammable. But in truth, if you think about it, children don't make the choice to move from one border to another, regardless of whether they're given the support services or reliable information to stay in Turkey for someone from Syria, for example, or in Egypt for someone from Palestine. They don't make that choice. So everyone should be united in their hearts to help children, whether unaccompanied or not, because they're not part of that decision process. They don't understand war. I remember there were 2 siblings. They were age 7. Rana and Nurullah, I believe their names were. They were from Syria. In Greece, unaccompanied children, up until only 1.5 years ago, were detained on arrival to Greece and Italy. And the reason was because they were safe zones for children. But children are going missing in these detention centers. And that's one of the main things that we do, whether it's in Greece or in Europe or in Libya. We help unaccompanied children be reunified with surviving family members, again, focusing on orphans, focusing on children, focusing on the fact that they have no choice. They aren't part of this decision-making process. One of the youngest children that we're supporting in Egypt is a 6-month-old baby called Ahmed, who was brought over. Refugees usually travel in whether tribes or groups from similar towns. And this baby ended up with no family members when he arrived in Cairo. And what we're doing as Goodwill Caravan is doing what we've always done. We aren't able to work in the countries where war is. We work in the first safe countries where refugees arrive, or the second or the third. And the main focus is legal, medical, shelter, but with a real focus on legal. Because, for example, these Palestinian refugees in Egypt, when they cross the border, many of my colleagues here would know this, they're given a piece of paper. I wish I had a picture of it. Just a piece of paper with their name on it. Unlike other refugees that we've met from different countries, they are not allowed to have the privilege to keep their passport, regardless of whether they wish to seek asylum or not, or move through Egypt to another country. This little piece of paper doesn't prove anything. They cannot have access to the job market. They don't even know how to apply for asylum in Egypt, for example. So we have legal clinics in Egypt with wonderful asylum and immigration lawyers that gather Palestinians and tell them what their rights are and how they can access the job market and how we can help them with the most basic things like food, shelter. But the reality is that we're now putting together a building in Egypt called the Salam Center Egypt. We have a Salam Center in Greece, Salam meaning peace. And it's a reception center for refugees from Sudan and from Palestine for them to come and get information on other wonderful sister organizations that are working in Egypt and in the surrounding areas so that they know who to go to. And the main aim is to reduce the likelihood of exploitation of these populations, from modern day slavery, from sex trafficking. Most of the refugees and families that we met in Egypt have nowhere to live. As you said, Vivian, earlier, they sold what's in front of them and what's behind them. That's an Arabic saying, to get across that border. And whatever means they used to cross the border, when they arrived in Egypt, there isn't a setup for them. There isn't a welcome center for them. They seem to be unseen or unimportant. And in fact, that's the wording that the hundreds of families that I personally go to Egypt now every month. And we've had the privilege of sitting with some of these families. And the wording that they used, we sat with refugees in Ismailia, which is closer to the border, and in Cairo. And they all used the term unseen and unheard. They asked why it is that for over 7 decades, why it is that they are not important and they don't exist, and why it is that the Geneva Convention does not apply to them when they arrive in the first safe country, why they were not given asylum quickly and swiftly and safety, why they have been overlooked. And so Goodwill Caravan is as a representative of Goodwill Caravan, I'm just honored to be here with some of my colleagues here from other humanitarian organizations making an effort, talking about rebuilding Gaza, talking about how there should be a voice and how these refugees should be seen. Most of them are not in Egypt out of choice. Most of the families, in fact, that we spoke to didn't want to cross the border, and they waited until they got to Rafah. And then in the Rafah was bombed. And they had no other choice but to cross because they want to protect their children and they want to protect their own lives. And so I encourage people to help the Goodwill Caravan and other organizations, not just us, that are trying to help these refugees from Palestine that they themselves describe themselves as unseen and unheard. I'll, on a final note, I think I have a couple of minutes left, talk about some of the students that we met in Ismailia University, again, closer to the border between Rafah and Egypt. And these students, there are 25 students initially that we met. They're 4th and 5th year medical students. Now imagine being a medical student who has felt guilty taking money from your family in Gaza to continue your education. Their only hope was to go back to Gaza and help people that needed medical assistance there. And many of them have lost their family, and recently. And so they're lost because everything that they were working towards to go back and make their families proud and help people in Gaza is gone. These are some of the examples of the refugees that we're trying to help complete medical school so they can go back and so they can help rebuild, which is what today's talk is about. And one more thing for Goodwill Caravan, we have sent, I think it's around 16 trucks into Gaza. More recently with the Rafah border issues, the closing and the opening and all the noise around that and how extremely corrupt Egypt is when it comes to, I don't want to get political, when it comes to the trucks going into the political situation being so difficult, just in general. We are now sending trucks through Karam Abu Salim, which is around 4 kilometers from Rafah, getting the permission from the other side for these trucks to cross. And most of what we're sending over is medical aid because that is what is needed. I'd like to take this opportunity to thank everyone here for welcoming me on behalf of Goodwill Caravan to share some of the work that we do and some of the stories that we've been privileged to have shared with us. Thank you so much, and God bless.
Thank you, Hanan. Thank you for sharing your stories and the powerful work you all are doing at Goodwill Caravan. I've learned so much from you, and particularly around this concept of the first safe country for refugees. Our final speaker today is Somaya Ouazzani, attorney, entrepreneur, and co-founder of Belgium-based nonprofit Children Not Numbers. Children Not Numbers was founded by 2 mothers in the UK with a mission to provide urgent support and long-term rehabilitation for children affected by conflicts and poverty, ensuring these children have access to medical care, education, and the advocacy they deserve to safeguard their well-being. In the past 9 months, Children Not Numbers has completed 150 medical evacuations for children in Gaza, placed 25 doctors and nurses on the ground in Gaza, and they are currently lobbying the UK government to grant more medical visas for the children injured in Gaza. Somaya, please tell us more about Children Not Numbers.
Thanks so much, Stephanie. It's a privilege to be among you all, and it's really humbling to hear of the amazing work that you're all doing. And it gives us a little bit of hope that actually there are good people like you and organisations like us responding to what has been monumental governmental failure around the world. So I'll start off by saying that we're a medical legal NGO. So we are an organisation made up primarily of doctors and lawyers. Everybody in our organisation is an unpaid volunteer, with the exception to what's now 29 doctors. Stephanie, since we spoke, we've recruited another 4 medics. Our key aims are to help support children receive urgent medical attention, whether that be through evacuation, medical evacuation, which we never pay for, and optimising medical care on the ground. The way we see us as doing that, and the way that we've done that, is by providing an emergency relief response with aid. So we're not an aid distribution organisation, but we've had to do that. So ensuring that children who have just had major surgeries, for example, have proper, decent nutrition and food to eat. We deliver that to the hospitals. We have a team of 4 aid distributors that work around Gaza to provide that aid. Yesterday, as an example, we provided 45 hot meals to doctors, nurses, and patients at Kamal Adwan, in and around Kamal Adwan Hospital. We have launched an optical centre in Gaza this week, where yesterday, for example, we had 15 children have eye tests and spectacles issued to them, having heard of a child that fell into a boiling pot of water and sustained very severe injuries because his glasses had been destroyed in a bombing. We are really committed actually to rebuilding the healthcare system. We know that it's been utterly decimated, and as a very small NGO that has really, we've been born in response to the horrors that we saw. No one in our organisation was working as a professional humanitarian before this, but so many of us have now made it our life's work. With the medical evacuations that we do, we see that it's utterly life-changing, and it gives these children a second chance at life. Our name, Children Not Numbers, is to identify that every single one of these children have a story. And if I may, I'm just going to share my screen with you now to show you some of the stories of some of the children. So very briefly, I'm just going to pull up, forgive me. Sorry, I've got the wrong, here we are. So can you see my screen? Are you able to see let me try again.
Not yet. We could see it 1 minute ago.
Okay. Can you see my screen now?
Yes.
Super. Okay, so I'm going to show you, this child here is called Amr. Amr is actually a wounded child with no surviving family, which Dr. Fawzi was talking to us about at the very beginning of the presentation. Except for his uncle. His uncle is a radiologist in the NHS in the UK, based in Liverpool, and this child was referred to us via a senior paediatrician in Gaza. He was the only surviving member of his family because when the airstrike happened, he was outside his house actually trying to get into his home. His 4 siblings, his mother, his father, all of his grandparents were killed. We evacuated Amr within 2 weeks to Egypt. And I'm pleased to say that Amr is actually now in the UK. He hasn't come to the UK as part of any medical treatment. That's something that we're still battling the UK government with, but he came by way of family reunification. This baby here is baby Tawfiq. Baby Tawfiq is a twin. He was born after his mother spent 20 years having IVF treatment, and he sustained a severe head trauma. We evacuated him to Egypt, and then with the help of Women for Palestine, we evacuated him to Qatar. His father was killed in the airstrike that injured him, but fortunately his mother survived, and she's now doing a wonderful job looking after the 2 of them in Qatar. This child here is baby Hanan. He is also a twin born to IVF. His mother and father spent 11 years trying to conceive him, and as a result of the bombardments, his mother went into premature labor. He was one of the sickest babies we've ever worked with, and actually this was one of the hardest evacuations we ever facilitated, largely because he needed a very, very high level of medical care during his transit period as well. Being born in the war, he had no documentation, so it was proving very difficult to evacuate him. And actually, there were a number of false starts where he was rejected at the border a number of times. But thankfully, he was evacuated to Egypt. And then we subsequently were able to get him to Qatar. And this is Hanan in the bottom photo now, thriving, doing incredibly well. His mother is doing a wonderful job caring for both of them. And she tells us all of the time that they've all had a chance to live life again. One of the things that we have had to do in response really to the horrors that we are seeing is launch an orphan program. That wasn't something that we were intending to do actually, but we heard Vivian talk about pivoting earlier on, and that's exactly what we've had to do. Some of the statistics that we've been given in preparing and calibrating an orphan sponsor program is look at really where the key focus on orphans is at the moment. And I'm just going to share my screen with you again, if I may. I'm just going to try and find, bear with me. Apologies. I'll try and pull that up in just a second, but some key data which we want to give you is that there are 37 children who lose their mother every single day in Gaza. That figure comes from UNRWA. We know that there are, at possibly worst case scenario, 30,000 orphans at the moment, because we must keep in mind that the figures we are given do not account for people that still remain under the rubble. And we know that by definition, an orphan in Gaza is a child who has lost his or her father or both parents. And until a death certificate for the father is seen, they are not considered an orphan. So with the number of people under the rubble, we're actually expecting the figures to be significantly higher. Euromed anticipates that 25,000 children have lost one or both of their parents, and UN Women estimates that at worst it's 19,000 children. So we know that the situation actually is catastrophic. Our focus is that within 4 weeks from today, we'll be launching an orphan sponsor program that focuses primarily on sick and injured orphans. And to do that, really what we're wanting to do is bring a really heightened focus to safeguarding, to wishes and feelings, and to ensuring that the well-being of these children is properly taken care of. Orphan programs are, by their very nature, incredibly high risk. We see every day some of the well-intended mistakes that can be made. What we've decided to do as part of that is make sure that we have a team of almost 15 people that are primarily responsible for this orphan program. So that means that the program coordinator, who is based on the ground in Gaza, he is actually chair of the emergency committee in the mid-city of Gaza. He will be the person that will be coordinating all of the data that we receive around these children, and enables us to fact check the information we receive. We are making sure that actually we are having a really robust and rigorous family identification process. So as you can imagine, given the desperation on the ground at the moment, there are many families that are going to be coming forward, many women, widowed women that will be coming forward wanting to take care of children. We will be ensuring that those families are properly vetted, 3 layers of vetting, that there will be full safeguarding reports done, that wishes and feelings of these children, where appropriate, is obtained. And then the next thing that we're going to be doing is really focusing quite heavily on a program that looks at education provision, well-being assessments, medical checks. One of the reasons why we've built such a big hub of medics on the ground is in Gaza is to help support this orphan program. We want to make sure that trauma support is provided, play therapy is provided, and that the care on the ground is done in a trauma-informed way. And we are just a very small organization, but we would like to think that so far our impact has been pretty big. We are hoping that this program will be a very long-lasting one and a big legacy that we leave behind. And if within 4 weeks we have 50 children that have been vetted, identified, had a full safeguarding report prepared, a family identified where they can be accommodated and rehoused, that for us will be what we would consider a really big sign to success. We're really grateful for your time and for considering the work that we're doing. And if you have any questions, we're very happy to answer them.
Thank you, Somaya. I love the way that you humanize the children in Gaza by sharing the individual stories and the children that you are helping at Children Not Numbers. So thank you very much. We've gotten some questions in the chat and we are a little bit ahead of schedule. So I'd like for Dr. Fawzi to take a few minutes and share some of his thoughts before we wrap up the event.
Thank you, Stephanie. I would like to first thank the panelists for the whole information that we hear today. And I want to thank each and every one of those who attended this session. I am sure they spare the time to hear us because they believe that this is a just cause, that we all must be united to help these children and these orphans. I want to urge them to be the voice of Gaza children. I am sure every one of them has contacts, has friends, has families, has politicians in his region to raise his voice to reach as much as possible, hundreds, thousands. With the social media, he can reach millions, by the way. So probably they can be like ambassadors of goodwill for these orphans. I'm sure they can. So this is my message to everybody listening to us today. Thank you, Stephanie.
Thank you, Dr. Fawzi. As we wrap up the meeting for today, you'll see on your screen more information about each of our speakers and their organizations and where you can learn more. Please note that the recording of this event will be shared in a follow-up email with more information, and we've been keeping track of the questions that have come in the chat, so we'll do our best to answer those and anything that we didn't get to today. To echo what Dr. Fawzi just shared, when you receive this email and the follow-up with the recording to this event, please share it with your communities, your colleagues, your friends, your family, your politicians. We need to reach more people and help raise more funding for the children of Gaza. Each of the organizations we've heard from today need funding and donations to continue doing this work. The pressure on every system in Gaza is just at catastrophic levels, and it costs money to rebuild, right? So there's a catastrophe of a massive magnitude, and each of us can do something to help ease the pain. Please give generously, share with your network, and do not forget the children of Gaza. Being an ambassador in any way that suits you, whether it's sharing information, having conversations with friends and family, posting on social. We need to humanize these children. We need to remind people that they deserve to live with dignity and the care that every child across the world needs and deserves. Note also that we hope to have more of these events to spread awareness and information. We are already connecting with many more organizations that are doing life-saving and life-changing work for the children and families in Gaza, and we hope to do more of these in the future. Our goal is to continue raising funding for these children because we believe that the global community bears responsibility for all children across the world. Thank you so much for your time today, and may we all go forward feeling more confident about how we can help the children of Gaza, including donating to the organizations we've heard from today. I'll echo Dr. Fawzi. Thank you to everybody who joined this call today, who took one step towards learning more. Thank you to each of our panelists. All of you are doing life-saving work every day. It's an honor to know you. It's an honor to hear from you. You are seen, you are heard, you are valued. We are so thankful for your contribution, and I hope everybody has a wonderful day today. Thank you so much.